And we're also welcoming back microbiologist and emergency trauma physician, Dr. Gil Mobley. Dr. Gil, we thank you again for your time. These new protocols issued by the CDC, your evaluation of them?
7 months too late. The White House says they've been planning on this for 7 months. You'd think they would have figured out what to do with the 55-gallon containers of hazardous waste that sat outside Emory University. You know, they're just asleep at the wheel. Nurses were putting tape around their neck 2 weeks ago to stop the containment. Yeah, it's timely, it's necessary, but a little too late, just like our response to West Africa, sir.
Dr. Mobley, can you tell us how you think these new guidelines differ from the ones set out by Doctors Without Borders?
They're closer to Doctors Without Borders. It seems like they've been more able to contain it than we have been in the finest hospital in Dallas. But quite frankly, it's layers. Layers is the answer, and careful putting on and mixing with antiseptic. Doctors Without Borders has forged the way, and I'm sorry to say, but I think they've done a better job than we have at containing it. You know, there are 120 healthcare professionals in West Africa, and 90 of them are dead. 120 of them with the disease, 90 of them are already dead. It's taking quite the toll, but they're in it nonstop.
Dr. Mobley, we take a look at this situation and we wonder what went wrong with healthcare workers being exposed to Ebola. How much are we getting the straight scoop from the CDC and from the administration on this?
What went wrong is all through September and even early October, they're saying the chances of getting a cluster were just infinitesimal or very small, while the WHO said it was inevitable. What went wrong is our guard was down. That's why Mr. Duncan was diagnosed. What went wrong is we failed to look at the most classic case. A guy buys a ticket, immediately he comes over here. He should have been in quarantine. What went wrong is somehow, I know that Fauci and I know that Frieden have a brain. What went wrong is somebody up high is nixing their ideas.
So the bottom line is, as you see it, it is political science rather than sound medical science at work in this case.
Locking down the borders in Nigeria worked. It worked, and it will work for us here. And if you can't follow the people, if you can't, then follow
Fair
the
enough.
people.
Dr. Mobley, time has gotten away from us here. Let's move now and talk about the midterms, taking a look at the Alaska Senate race.
The gubernatorial race in Alaska started out as you might expect. There was a Republican and a Democrat. Both easily won their primaries and were set to square off on the campaign trail, with incumbent Sean Parnell predicted to slide right back in for a second term. But now that Election Day is nearly here, that suddenly isn't the case anymore. Not long after the August primaries, Alaska's Democratic Party voted to reject their candidate, Brian Malat. They didn't kick him to the curb. Instead, they relegated him to run as lieutenant governor to independent Bill Walker. Republicans didn't waste any time challenging the newly formed ticket by filing a lawsuit against state election officials for allowing this unusual merger to happen. Alaska's Supreme Court upheld the ticket. The shakeup raised a few eyebrows, considering a year prior, the Alaska Democratic Party unanimously voted to back Malat for governor. However, recent polls show that the move may pay off. Walker is building support and is now in a comfortable lead over Parnell. But Parnell may not be out of it just yet. There's still a significant amount of undecided voters out there who just may end up turning the tide in favor of Parnell.
And as you just heard, thanks to a large number of undecided voters, political analysts say this gubernatorial race could go down to the wire. For more, go to Newsmax.com as we continue our countdown to the midterms, and be sure to join us here on Newsmax TV election night. America's Forum continues here on Newsmax TV.